So that's one way liver affects orthopedic situation. The other way is higher levels of inflammation. And again, if you watch my webinars, you know I think and I believe, based on everything I've read and learned, almost all orthopedic problems come down to oxidative stress and chronic inflammation, just like every other chronic non-communicable disease in the world. So in the setting of chronic liver disease, NAFLD NASH, you have higher levels of inflammatory proteins, otherwise known as cytokines, such as IL-1, IL-6, and tumor necrosis factor alpha. Now, IL-6 and tumor necrosis factor alpha, they may ring a bell if you watched my autoimmune talk. They're always upregulated in conditions like rheumatoid or lupus, things like that. So just having a bad dysfunctional liver can upregulate these cytokines with or without an autoimmune disease. And when you have these pro-inflammatory proteins running around your body, like TNF-alpha, then you upregulate the bone chewing cells, the osteoclasts. So your bone is constantly being maintained and remodeled, and there's a balance normally between osteoclasts that chew up damaged bone or dysfunctional bone and osteoblasts that replace it with better bone. And then osteoclastic activity is brought about by this substance called RANK-L, which is receptor activator for nuclear kappa factor ligand. Basically, this is a receptor that, when triggered, increases levels of NF-κB, which is a gene that upregulates inflammation. And it also turns on the osteoclasts, or the bone chewing cells. So not only do you get hepatic osteodystrophy, lower levels of active vitamin D3, problems with the medications, but now we've got more inflammation just because of the fat that's been packed all through the liver in the setting of insulin resistance and an unhealthy liver.